Hey, Alpha Nurses, I'm Licensure from alphanursguy.com. These are NCLEX practice questions. Without the way, let's get started.
Which of the following is an assessment finding associated with internal bleeding with disseminated intravascular coagulation? 1. Bradycardia. 2. Hypertension. 3. Increasing abdominal girth. 4. Petechiae. The correct answer is 3. As blood collects in the peritoneal cavity, it causes dilation and distension, which is reflected in increased abdominal girth. The client will be tachycardic and hypotensive. Petechiae reflect bleeding in the skin. The nurse identifies deficient knowledge when the client undergoing induction therapy for leukemia makes which of the following statements? 1. I will pace my activities with rest periods. 2. I can't wait to get home to my cat. 3. I will use warm saline gargle instead of brushing my teeth. 4. I must report a temperature of 100 degrees Fahrenheit. The correct answer is 2. The nurse identifies that the client does not understand that contact with animals must be avoided because they carry infection, and the induction therapy will destroy the client's white blood cells. The induction therapy will cause anemia, and the client will experience fatigue and will have to pace activities with rest periods. Platelet production will be decreased, and the client will be at risk for bleeding tendencies. Oral hygiene will have to be provided by using a warm saline gargle instead of brushing the teeth and gums. The client will be at risk for infection owing to the decrease in WBC production and should report a temperature of 100 degrees Fahrenheit or higher. The client with Hodgkin's disease undergoes an excisional cervical lymph node biopsy under local anesthesia. After the procedure, which does the nurse assess first? 1. Vital signs. 2. The incision. 3. The airway. 4. Neurologic signs. The correct answer is 1. The nurse must ensure that sterile technique is used when a biopsy is obtained because the client is at high risk for infection. In most cases, a lymph node biopsy is sent immediately to the laboratory once it is placed in a specific solution in a closed container. It is not necessary to wear a gown and mask when obtaining the specimen. It is not necessary to use special handling procedures for the instruments used. A young adult is diagnosed with infectious mononucleosis. The white blood cell count is 19,000 microliter. The client has a streptococcal throat infection, enlarged spleen, and aching muscles. Which of the following instructions should the nurse include in discharge planning with client? Select all that apply. 1. Stay on bed rest until the temperature is normal. 2. Gargle with warm saline while the throat is irritated. 3. Increase intake of fluids until the infection subsides. 4. Wear a mask if others are present. 5. Avoid contact sports while the spleen is enlarged. The correct answers are 1, 2, 3, and 5. The nurse should teach this client to stay on bed rest as long as there is a fever, gargle with warm saline, and increase oral fluids to prevent dehydration from the elevated temperature. The client with an enlarged spleen should avoid contact sports due to the increased risk of injury due to the enlargement. The client does not need to wear a mask, but should observe hand washing procedures. A client with suspected diagnosis of Hodgkin's disease is to have a lymph node biopsy. The nurse should make sure that personnel involved with the procedure do which of the following when obtaining the lymph node biopsy specimen for a histologic examination for this client? 1. Maintain sterile technique. 2. Use a mask, gloves, and a gown when assisting with the procedure. 3. Send the specimen to the laboratory when someone is available to take it. 4. Ensure that all instruments used are placed in a sealed and labeled container. The correct answer is 1. The nurse must ensure that sterile technique is used when a biopsy is obtained because the client is at high risk for infection. In most cases, a lymph node biopsy is sent immediately to the laboratory once it is placed in a specific solution in a closed container. It is not necessary to wear a gown and mask when obtaining the specimen. It is not necessary to use special handling procedures for the instruments used. The daily white blood cell count in a client with aplastic anemia drops overnight from 3,900 to 2,900 microliter. Which is the appropriate nursing intervention? 1. Continue monitoring the client. 2. Call the laboratory to verify the report. 3. Document the finding. 4. Call the physician and request that the client be placed in reverse isolation. The correct answer is 4. The client will need a prescription from the physician to be placed in reverse isolation because the normal defenses are ineffective and place the client at risk for infection. The faster the decrease in WBCs, the greater the bone marrow suppression, and the more susceptible the client is to infection from not only pathogenic but non-pathogenic organisms. The client will continue to be monitored. The laboratory may be called, and the report will be placed on the chart, but protection of the client must be instituted immediately. Which of the following clinical manifestations does the nurse most likely observe in a client with Hodgkin's disease? 1. Difficulty swallowing. 2. Painless, enlarged cervical lymph nodes. 3. Difficulty breathing. 4. A feeling of fullness over the liver. The correct answer is 2. Painless and enlarged cervical lymph nodes, tachycardia, weight loss, weakness and fatigue, and night sweats are signs of Hodgkin's disease. Difficulty swallowing and breathing may occur, but only with mediastinal node involvement. Hepatomegaly is a late-stage manifestation. A client who had an exploratory laparotomy 3 days ago has a white blood cell differential with a shift to the left. The nurse instructs unlicensed personnel to report which clinical manifestation? 1. Swelling around the incision. 2. Redness around the incision. 3. Elevated temperature. 4. Purulent wound drainage. The correct answer is 3. A shift to the left means that more immature than mature WBCs are at the site of inflammation or infection. Immature WBCs are less effective at phagocytosis and do not produce classic signs of inflammation, such as pus, redness, swelling, or heat. Fever is the only sign. Therefore, it is a significant sign of infection in a client with immature or depressed WBCs. The nurse's best explanation for why the severely neutropenic client is placed in reverse isolation is that reverse isolation helps prevent the spread of organisms. 1. To the client from sources outside the client's environment. 2. From the client to healthcare personnel, visitors, and other clients. 3. By using special techniques to dispose of contaminated materials. 4. By using special techniques to handle the client's linens and personal items. The correct answer is 1. The primary purpose of reverse isolation is to reduce transmission of organisms to the client from sources outside the client's environment. The nurse is developing a care plan for a client with leukemia. The plan should include which of the following? Select all that apply. 1. Monitor temperature and report elevation. 2. Recognize signs and symptoms of infection. 3. Avoid crowds. 4. Maintain integrity of skin and mucous membranes. 5. Take a baby aspirin each day. The correct answers are 1, 2, 3, and 4. Nursing care of a client with leukemia includes managing and preventing infection, maintaining integrity of skin and mucous membranes, instituting measures to prevent bleeding and monitoring for bleeding. Aspirin is an anticoagulant. Bleeding tendencies, such as petechiae, ecchymosis, epistaxis, gingival bleeding, and retinal hemorrhages are likely due to thrombocytopenia. In providing care to the client with leukemia who has developed thrombocytopenia, the nurse assesses the most common sites for bleeding. Which of the following is not a common site? 1. Biliary system. 2. Gastrointestinal tract. 3. Brain and meninges. 4. Pulmonary system. The correct answer is 1. The biliary system is not especially prone to hemorrhage. Thrombocytopenia, a low platelet count, leaves the client at risk for a potentially life-threatening spontaneous hemorrhage in the gastrointestinal, respiratory, and intracranial cavities. A client with neutropenia has an absolute neutrophil count of 900. What is the client's risk of infection? 1. Normal risk. 2. Moderate risk. 3. High risk. 4. Extremely high risk. The correct answer is 2. A client is at moderate risk when the ANC is less than 1,000. The ANC decreases proportionate to the increased risk for infection. Normal risk for infection is when the ANC is 1,500 or greater. High risk for infection is when the ANC is less than 500. An ANC of 100 or less is life-threatening. The nurse is evaluating the client's learning about combination chemotherapy. Which of the following statements by the client about reasons for using combination chemotherapy indicates the need for further explanation? 1. Combination chemotherapy is used to interrupt cell growth cycle at different points. 2. Combination chemotherapy is used to destroy cancer cells and treat side effects simultaneously. 3. Combination chemotherapy is used to decrease resistance. 4. Combination chemotherapy is used to minimize the toxicity from using high doses of a single agent. The correct answer is 2. Combination chemotherapy does not mean two groups of drugs, one to kill the cancer cells and one to treat the adverse effects of the chemotherapy. Combination chemotherapy means that multiple drugs are given to interrupt the cell growth cycle at different points, decrease resistance to a chemotherapy agent, and minimize the toxicity associated with use of a high dose of a single agent. Which factor, in addition to the degree of neutropenia, should the nurse assess in determining the client's risk of infection? 1. Length of time neutropenia has existed. 2. Health status before neutropenia. 3. Body build and weight. 4. Resistance to infection in childhood. The correct answer is 1. The one factor that may be more important than the degree of neutropenia in determining the risk for infection is the duration of the neutropenia. The client with acute leukemia and the healthcare team establish mutual client outcomes of improved tidal volume and activity tolerance. Which measure will be least likely to promote outcome achievement? 1. Ambulating in the hallway. 2. Sitting up in a chair. 3. Lying in bed and taking deep breaths. 4. Using a stationary bicycle in the room. The correct answer is 3. The client with acute leukemia experiences fatigue and deconditioning. Lying in bed and taking deep breaths will not help achieve the goals. The client must get out of bed to increase activity tolerance and improve tidal volume. Ambulating in the hall is a sensible activity and helps improve conditioning. Sitting up in a chair facilitates lung expansion. Using a stationary bicycle in the room allows the client to increase activity as tolerated. Which nursing action is important in preventing cross-contamination? 1. Change gloves immediately after use. 2. Stand 2 feet from the client. 3. Speak minimally when in the room. 4. Wear long-sleeved shirts. The correct answer is 1. Bedside rails, called bells, drug administration controls operated by the client, and other surface areas are frequently touched by caregivers with used gloves. Changing gloves immediately after use protects the client from contamination by organisms. Cross-contamination is a break-in technique of serious consequence to the severely compromised client. Standing 2 feet from the client, speaking minimally, and wearing long-sleeve shirts are not required in standard interventions for risk of infection. The nurse is planning care with a client with acute leukemia who has mucositis. The nurse should advise the client that after every meal and every 4 hours while awake, the client should use 1. Lemon glycerin swabs. 2. A commercial mouthwash. 3. A saline solution. 4. A commercial toothpaste and brush. The correct answer is 3. Simple rinses with saline or a baking soda and water solution are effective and moisten the oral mucosa. Commercial mouthwashes and lemon glycerin swabs contain glycerin and alcohol, which are drying to mucosa and should be avoided. Brushing after each meal is recommended, but every 4 hours may be too traumatic. During acute leukemia, The neutrophil and platelet counts are often low, and a soft bristle toothbrush, instead of the client's usual brush, should be used to prevent bleeding gums. The nurse should teach the client with neutropenia and the family to avoid which of the following? 1. Using suppositories or enemas. 2. Using a high-efficiency particulate air filter mask. 3. Performing perineal care after every bowel movement. 4. Performing oral care after every meal. The correct answer is 1. The neutropenic client is at risk for infection, especially bacterial infection of the respiratory and gastrointestinal tracts. Breaks in the mucous membranes, such as those that could be caused by the insertion of suppository or enema tube, would be a break in the first line of the body's defense and a direct port of entry for infection. The client with neutropenia is encouraged to wear a HEPA filter mask and to use an incentive spirometer for pulmonary hygiene. The client needs to know the importance of completing meticulous total body hygiene daily, including perineal care after every bowel movement, to decrease the flora at normal body orifices. The client also needs to know the importance of performing oral care after every meal and every 4 hours while the client is awake to decrease the bacterial buildup in the oropharynx. In assessing a client in the early stage of chronic lymphocytic leukemia, the nurse should determine if the client has 1. Enlarged, painless lymph nodes. 2. Headache. 3. Hyperplasia of the gums. 4. Unintentional weight loss. The correct answer is 4. Clients with CLL develop unintentional weight loss, fever and drenching night sweats, enlarged, painful lymph nodes, spleen, and liver, decreased reaction to skin sensitivity test energy, and susceptibility to viral infections. Enlarged, painless lymph nodes are a clinical manifestation of Hodgkin's lymphoma. A headache would not be one of the early signs and symptoms expected in CLL, because CLL does not cross the blood-brain barrier and would not irritate the meninges. Hyperplasia of the gums is a clinical manifestation of AML. The nurse should remind family members who are visiting a client with granulocytopenia to 1. Visit only if they do not have a cold. 2. Wash their hands. 3. Leave the children at home. 4. Avoid kissing the client on the lips. The correct answer is 2. Washing hands before, during, and after care has a significant effect in reducing infections. It is advisable to avoid introducing a cold or children's germs and to avoid kissing on the lips, but the primary prevention technique is hand washing. The client with acute lymphocytic leukemia is at risk for infection. The nurse should 1. Place the client in a private room. 2. Have the client wear a mask. 3. Have staff wear gowns and gloves. 4. Restrict visitors. The correct answer is 1. Clients with all are at risk for infection due to granulocytopenia. The nurse should place the client in a private room. Strict hand washing procedures should be enforced and will be the most effective way to prevent infection. It is not necessary to have the client wear a mask. The client is not contagious, and the staff does not need to wear gloves. The client can have visitors. However, they should be screened for infection and use hand washing procedures. The nurse should remind the unlicensed personnel that which of the following is the most important goal in the care of the neutropenic client in isolation? 1. Listening to the client's feelings of concern. 2. Completing the client's care in a non-hurried manner. 3. Completing all the client's care at one time. 4. Instructing the client to dispose of the tissue used after blowing the nose. The correct answer is 4. The most common source of infection and microbial colonization in neutropenic clients is their own non-pathogenic normal flora. Attention to personal hygiene, such as oral, pulmonary, urinary, and rectal care, is essential. It is important to acknowledge the client's concerns and fears and to provide organized, non-hurried caring care. But it is more important to teach the client how to prevent an infection that could be life-threatening. Which of the following individuals is most at risk for acquiring acute lymphocytic leukemia? The client who is 1. 4 to 12 years. 2. 20 to 30 years. 3. 40 to 50 years. 4. 60 to 70 years. The correct answer is 1. The peak incidence of all is at 4 years of age. All is uncommon after 15 years of age. The median age at incidence of CML is 40 to 50 years. The peak incidence of AML occurs at 60 years of age. 2/3 of cases of chronic lymphocytic leukemia occur in clients older than 60 years of age. A nurse is obtaining consent for a bone marrow aspiration. What should the nurse do? Select all that apply. 1. Witness the client sign a consent form. 2. Evaluate that the client understands the procedure. 3. Explain the risks of the procedure to the client. 4. Verify that the client is signing consent form of his or her own free will. 5. Determine that the client understands post-procedure care. The correct answers are 1, 2, 4, and 5. The nurse can serve as a witness for consent for procedures. The nurse also ascertains whether the client has an understanding that is consistent with the procedure listed on the form, determines that the client is signing the consent of his or her own free will, and determines that the client understands post-procedure care. The nurse's role does not include explaining the risks of the procedure. That responsibility belongs to the person who is to perform the procedure, such as the physician. The nurse is assessing a client with chronic myeloid leukemia. The nurse should assess the client for 1. Lymphadenopathy. 2. Hyperplasia of the gum. 3. Bone pain from expansion of marrow. 4. Shortness of breath. The correct answer is 4. Although the clinical manifestations of CML vary, clients usually have confusion and shortness of breath related to decreased capillary perfusion to the brain and lungs. Lymphadenopathy is rare in CML. Hyperplasia of the gum and bone pain are clinical manifestations of AML. A client is about to undergo bone marrow aspiration of the sternum. Which of the following statements should the nurse include to provide information to the client about what the client will feel during the procedure? 1. You may feel a warm solution being wiped over your entire front from your neck down to your navel and out to your shoulders. 2. You will not feel the local anesthetic being applied because it will be sprayed on. 3. You will feel a pulling type of discomfort for a few seconds. 4. After the needle is removed, you will feel a bandage being applied around your chest. The correct answer is 3. As the bone marrow is being aspirated, the client will feel a suction or pulling type of sensation or discomfort that lasts a few seconds. A systemic premedication may be given to decrease this discomfort. A small area over the sternum is cleaned with an antiseptic. It is unnecessary to paint the entire anterior chest. The local anesthetic is injected through the subcutaneous tissue to numb the tissue for the larger bore needle that is used for aspiration and biopsy. After the needle is removed, pressure is held over the aspiration site for 5 to 10 minutes to achieve hemostasis. A small dressing is applied. A large pressure dressing, such as an ACE bandage, would restrict the expansion of the lungs and is not used. The goal of nursing care for a client with acute myeloid leukemia is to prevent 1. Cardiac arrhythmias. 2. Liver failure. 3. Renal failure. 4. Hemorrhage. The correct answer is 4. Bleeding and infection are the major complications and causes of death for clients with AML. Bleeding is related to the degree of thrombocytopenia, and infection is related to the degree of neutropenia. Cardiac arrhythmias rarely occur as a result of AML. Liver or renal failure may occur, but neither is a major cause of death in AML. 24 hours after a bone marrow aspiration, the nurse evaluates which of the following as an appropriate client outcome. 1. The client maintains bed rest. 2. There is redness and swelling at the aspiration site. 3. The client requests morphine sulfate for pain. 4. There is no bleeding at the aspiration site. The correct answer is 4. After a bone marrow aspiration, the puncture site should be checked every 10 to 15 minutes for bleeding. For a short period after the procedure, bed rest may be prescribed. Signs of infection, such as redness and swelling, are not anticipated at the aspiration site. A mild analgesic may be prescribed. If the client continues to need the morphine for longer than 24 hours, the nurse should suspect that internal bleeding or increased pressure at the puncture site may be the cause of the pain and should consult a physician. A client with acute myeloid leukemia reports overhearing one of the other clients say that AML had a very poor prognosis. The client has understood that the client's physician informed the client that his physician told him that he has a good prognosis. Which is the nurse's best response? 1. You must have misunderstood. Who did you hear that from? 2. AML does have a very poor prognosis for poorly differentiated cells. 3. AML is the most common non-lymphocytic leukemia. 4. Your doctor stated your prognosis based on the differentiation of your cells. The correct answer is 4. The statement, your doctor stated your prognosis based on the differentiation of your cells, addresses the client's situation on an individual basis. The nurse is clarifying that clients have different prognoses, even though they may have the same type of leukemia, because of the cell differentiation. Stating that the client misunderstood is inappropriate for an advocate of the client and serves no useful purpose. The other statements are true, but do not address this client's individual concern. A client states, I don't want any more tests. Who cares what kind of leukemia I have? I just want to be treated now. Which is the nurse's best response? 1. I'm sure you are frustrated and want to be well now. 2. Your treatment can be more effective if it is based on more specific information about your disease. 3. Now you know the tests are necessary and that you are just upset right now. 4. I understand how you feel. The correct answer is 2. The nurse is an advocate for client with leukemia who can be empowered with knowledge of the treatment. Immunologic, cytogenic, morphologic, histochemical, and other means are used to identify cell subtypes and stages of leukemia cell development for very specific and optimal treatment. The nurse should not label the client's feeling, such as frustration or emotional. Only the client can identify her own feelings. Chastising the client is not helpful. It disavows the client's emotional state and responses to her diagnosis and involved treatment. Unless nurses have had leukemia, they cannot possibly know how the client feels, even though they may be trying to offer her empathy.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.